All right, let's talk about something that affects millions of people, but its true cost is kind of hidden in plain sight. We're going to unpack the economics of age-related macular degeneration, or AMD for short. And you'll see, it's not just a health problem, it's a massive economic challenge for every single one of us. Okay, let's jump right in.
But first, I want to kick things off with a question for you. What if one of the biggest financial drains on our entire society wasn't something you read about in the business section, but a health condition we actually have the tools to fight right now? Just keep that thought in the back of your mind as we go through this.
To really wrap our heads around this, we first have to understand the sheer scale of the problem. And believe me, it is way bigger and a lot more complex than most people think.
So, what exactly is AMD? Well, to put it simply, it's one of the main reasons older adults lose their sight. And this isn't some rare disease. We are talking about over 200 million people around the globe who are living with it today. I mean, just let that number sink in for a second. It's huge.
Now, this is where it gets really interesting. When you think about medical costs, you probably think of prescriptions and doctor's appointments, right? Well, for AMD, that's barely 20% of the total cost. The lion's share, a whopping 80% when you combine them, comes from things like long-term care and lost productivity. That's people having to leave their jobs and caregivers having to leave theirs too. This is the hidden engine driving the crisis.
Okay, so let's see how this all adds up. And I gotta warn you, the numbers we're about to look at are, well, they're truly mind-boggling. They tell the story of a silent economic giant.
Let's start with the global view. $411 billion. That's the estimated price tag every single year just from lost productivity because of vision problems. And AMD is a major driver of that.
Okay, now let's zoom in and bring it home to just the United States. We're talking nearly $50 billion a year. And get this, that's the cost for late-stage AMD alone.
And here's the kicker. This isn't a problem that's shrinking. It's on track to get much bigger. By 2040, it's projected that 288 million people will have AMD. This is a snowball rolling downhill, and it's going to put an even heavier strain on our economies and on families if we don't do something.
So you hear numbers like that, and you think AMD would be a huge topic of conversation, right? Front-page news, public health campaigns. Well, let's put it in perspective with a really important comparison.
Think about how often we hear about dementia, and for good reason. It's a devastating condition. But here's the thing. In terms of how many people are affected, AMD is right up there with dementia, and in some cases, it affects even more people. But here is the most crucial difference, the real takeaway. Unlike dementia, we already have proven, concrete ways to slow AMD down. This makes the lack of public awareness a massive missed opportunity.
And that brings us to the most important part of this whole explainer. We've laid out the problem, and it's a big one. But now, let's shift gears and talk about the solutions, because there's a lot of good news and there is a clear, hopeful path forward.
See, the great news is we have an entire toolkit ready to go. We're not waiting for some futuristic cure. It's all about using strategies that we know work right now. Things like nutritional support, catching it early, simple lifestyle changes, and of course, education. These are the keys to saving both people's sight and a whole lot of money.
So, what's in this toolkit? Let's break it down into a real action plan focusing on things that are not only effective, but also cost-effective. First up, things that anyone can start doing today. Simple but powerful lifestyle changes. Quitting smoking is a huge one. Eating a diet with more leafy greens and antioxidants. Even just remembering to wear sunglasses to block UV light, or keeping an eye on your blood pressure. These aren't complicated things, but they can make a real, tangible difference to your risk.
And we can get even more targeted than that. Specific nutritional support has been a total game changer. I'm talking about formulas based on major clinical trials like the AREDS 2 studies. They are scientifically proven to be a cost-effective way to slow down the progression of AMD for a lot of people. It's incredible.
Now, what about the more aggressive type, the one called wet AMD? Well, we even have a highly effective medical treatment for that. It's called anti-VEGF therapy. Basically, as you can see here, these are injections that stop abnormal blood vessels from growing in the back of the eye. This treatment is now the standard of care because it works. It directly steps in to save sight and prevent that severe vision loss that drives up all those other costs we talked about.
And really, this all comes down to one core message. This quote from the research just says it all perfectly. Protecting sight is not just a medical necessity, it is a matter of economic sustainability. It's this direct line connecting an individual's health to the financial health of all of us.
So, we'll end right where we started, with a question. The knowledge is there. The tools are in our hands. We know how to tackle one of the biggest drivers of vision loss and its massive economic fallout. The solutions aren't a mystery. So, the real question is, if we can save both sight and money, what on earth are we waiting for?